my name's Lauren. I'm going to be doing your oral mechanism exam. I'm going to be looking at the strength, movement, and coordination of the muscles in your face, your mouth, things that are important for speaking, swallowing, chewing. And so I just want to make sure to let you know if you're uncomfortable at any point in this, you can let me know and we can pause, okay? Okay, so I want to make sure first that you are in a 90-degree angle. Good, because we want to make sure that all the information I'm gaining is accurate. Okay, so great body positioning. I'm also noticing that your muscles aren't tightening to a point where you can't move your, parts of your body, so that's good. Can I just have you breathe normally right now for me? Okay, good. I'm noticing you have good respiration. There doesn't seem to be any distress, so that's good. All right, so I'm gonna have you go ahead and hold your breath for 5 seconds. I'm gonna put my finger under your nose just to check for any nasal emission. Okay, hold your breath for 5 seconds. Okay, good, great. And that's really important for protection during swallowing. All right, so are you able to breathe comfortably through your nose?
Yes.
Okay, good. So there's no obstruction there as well. Okay. All right. So also now I'm going to be checking your lips. So can I have you go ahead and puck your lips like this and smile? And now I'm going to have you go between those two movements by saying ooh wee, ooh wee, ooh wee, ooh wee. Good. Okay. All right. So now I'm going to have you go ahead and close your lips tightly. Okay. Just like this. Okay, and I'm gonna try and open, and I want you to keep it closed. Okay, good. Now I'm gonna use the tongue depressor, and I'm gonna have you hold it between your lips, and I'm gonna try and pull it away, and I just wanna see, do you have tight lip seal? Good, great, thank you. All right, that's really good. Good lip seal. Okay, so now I'm gonna have you go ahead and puff your cheeks with air. And if I try to deflate, can you keep that air in there? Good. Okay, now I'm gonna have you transfer the air from one cheek to another. Good, great. Shows the buccal muscles are working well. Okay, so now can you smack your lips together? Good, okay. And go ahead and remove your glasses, or you can put them up. I'm gonna have you close your eyes and keep them closed. I'm gonna try and lift them and open them as well, okay? Great, okay, you can go ahead and open. Great job. Can you please raise your eyebrows for me? Good, smile, frown, good. All right, good symmetry, good protrusion, retraction of your lips. They stay sealed. Your buccal muscles, as I said, are functioning well, as are your facial muscles. Now let's focus on your jaw. Okay, so I'm gonna have you open and close your jaw kind of slowly. Good. Okay, so now I'm gonna have you go ahead and move your jaw side to side like this. Good. And can you kind of stick out your jaw like you have an underbite? Good. Okay. Now, can you go ahead and open your jaw again? And if I try to close it, can you keep it open? Good. And now I'm gonna have you just close your mouth like that. If I try to open your jaw, can you keep it closed? Good. All right, good. And I get a good range of motion, no clicking or popping, so that's great. Okay, so now I'm gonna have you go ahead and stick out your tongue as far as you can. Go ahead and go side to side with it. Good range of good range of motion. I'm gonna have you lift your tongue to the roof of your mouth on the inside of your mouth. So up here and now down. Now stick your tongue out and go ahead and lift it up to your nose. Can you touch your nose with it? Good, and then down to your chin. Okay, good. Well done. Now, I'm gonna have you go ahead and push your tongue up against the tongue depressor and kind of push with all your strength, okay? Good. Now I'm gonna put it on the side of your tongue, and I want you to push it laterally this way. Okay, can you do the other side? Good. Okay. Good. Well done. All right, so now pretend you have peanut butter on the roof of your mouth, and I want you to kind of scrape it off using your tongue. Good, well done. All right, can you touch on the inside of your mouth, touch your cheek with your tongue, and I'm gonna kind of push against my hand, okay, on the other side. All right, that's great. We got that. Now I'm going to have you sweep your tongue around your lips in both directions like this. Good. Great job. Okay, now I'm going to have you say ka 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 la 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 la.
Ka 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 la 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 la.
Good, good. Anterior, posterior movement, symmetry, size, and strength are good. I didn't see any uncontrolled movement. Your tongue went up, elevated, retracted. Range of motion was good. And you have the ability to clear your palate. So I also noticed you had a good sized frenulum, which is the part of underneath your tongue that attaches to the bottom of your mouth. So that's also really good. All right, so now I'm gonna use my pen light to kind of look inside of your oral cavity. I'm gonna have you say, ah for me.
Ah.
Good, I see your fascial pillars. I also see your soft palate. Great job. Yep, I see good lining of your structures here. Yes, good. That looks great. The alveolar ridge, also that bumpy part behind your teeth was good color. The lateral sulci looked well. Okay, and your uvula, yeah. Okay, so I'm gonna have you say ah, 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 ah for me.
Ah, 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 ah.
Okay, so you have good bilateral soft palate elevation. Okay, so this is kind of the uncomfortable part. I'm gonna walk this back on your tongue and we're gonna test your gag reflex. I'm gonna walk this back to the back of your tongue, okay? Okay, go ahead and stick out your, yeah, I'm just gonna, okay? Good, sorry about that. Okay, so now I'm gonna use my pen light again. I'm gonna be looking at your dentition, okay? Okay, good. I don't see any missing teeth. Can you smile for me? Good. I don't see any underbite or overbite, so that's good. And I also noticed that you don't have any secretions escaping throughout this entire exam. So have you noticed you've been able to handle your saliva well?
Yes.
Okay, that's good. All right, so also the tone and symmetry of your lips, tongue, and teeth and jaw are looking good. There's no drooping. All right, we're gonna check your voice. So I'm gonna go ahead and have you just take a deep breath and say ah for me.
Ah.
For as long as you can. I'm sorry, I'm gonna have to start again. Okay, that's good. So I didn't hear anything wet, hoarse, or breathy quality. Can you give me a cough? Can you clear your throat? Good. All right, so next I'm gonna try test something called your DDK rate. So I'm basically looking at your coordination. So the first thing I'm gonna do 10 seconds on the clock, and I'm gonna have you say the sound pa 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 as fast as you can for 10 seconds. Are you ready? Go ahead. Good. All right, so now the next sound is ta 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 ta. Are you ready? Okay, go ahead. Great. Okay, and the last thing is ka 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 ka. All ready? Okay, go ahead. Good. All right, so then now I'm going to have you put all three of them together, and you're going to say pataka, 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 and you're going to do that for as fast as you can for 10 seconds. Okay? Go ahead.
Patika, 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 patika.
Good. Well done. Okay, really good coordination. Now I'm going to test your sensitivity of your face and your oral cavity. So I'm going to take a cotton swab and I'm just going to kind of touch different parts of your face. You'll raise your hand when you feel it and just let me know where you feel it. Okay? Go ahead and close your eyes. Okay, where do you feel it?
Left cheek.
Good.
Forehead.
Good. Chin. Good. Now I'm going to get another cotton swab and I'm going to have you go ahead and we're going to have you open your mouth and I'm going to touch different parts of your tongue, okay? Keep your mouth closed or your eyes closed, sorry. All right. Yes, where do you feel it?
Left side of my tongue.
Okay. Yes.
Tip of my tongue.
Good.
Left side or right side, sorry.
You're fine. Good. All right. Good. So that's good sensitivity. So you were really alert and responsive during the exam. I'm going to make note of that. Do you have any questions?
No.
Okay, so we're going to move on to our oral trials next.
Okay.
Okay.